Hello guys, this is the second video of details and issues and experience on Nissen fundoplication. Um, I had a surgery 3 months ago. This is the second video. I haven't had much time. Obviously, everybody's got things to do. Um, to make an earlier one, I wanted to do like a week to week or so, but it's been 3 months. The last one I updated was like a week after the surgery. Nissen fundoplication. It was a full wrap. Um, so there's a few things that I would want to talk about. First of all, issues that came with the surgery and still dealing with now would be some dysphagia, meaning um, trouble swallowing. It's it's improved a lot, definitely. A diarrhea, cramping, and bloating. Bloating in my back and in my stomach area. I get, after eating, hiccups. I had a lot of nausea within the first 2 months. It has improved a lot, especially if I eat at my times. You know, if I don't let my body just starve, kind of thing. So those are a few things that I dealt with. Um, Now, on the first video I mentioned, I had some trouble swallowing and I had headaches and everything. That is possible when you get a throat infection. I got a throat infection from the doctors going into my esophagus to check how the Nissen, to check how the fundoplication was done, how tight the wrap was. Um, Now, what I would suggest before you have the surgery, if you're considering having this surgery, is look at, first of all, the side effects from the surgery, and for sure talk to your surgeon or the doctor. Ask them all the questions you have. Doesn't matter if it takes hours. I would suggest write down concerns that you have, because, for instance, I went to my doctor, I talked to him for hours, and I also mentioned a few things that I was concerned, and I told him, hey, so will I be losing weight? Because, I mean, I am a pretty skinny person as it is. When I got married, I gained reasonable weight, so I was okay with that, nothing too much. Um, but I've always been a skinny person. I've always been a slim guy, you can say. Um, so after the surgery, or before the surgery, I asked the surgeon and the doctors, will I have any trouble eating? Any eating disorders? Any loss of appetite? Any loss of weight? And he was like, no, pretty much any surgery that we do with this doesn't really affect your eating habits. Okay, everything was fine. Long story short, I went with the surgery, obviously. And for the first 2 weeks, I was on a liquid diet. You have to be in a liquid diet, especially for a full wrap, because there's a partial wrap. That's another thing that I'm going to address in a little bit. And there's a full wrap. The full wrap was done to me, obviously, and first of all, I had to be in a liquid diet because obviously my insides, my stomach, my esophagus was swollen, and you can't really force it. It could be dangerous, rips the stitches, and pretty much bleed out or something. So you have to be careful, and you have to be in a liquid diet or a blenderized diet after a few weeks. So I was in the blenderized liquid diet for about, I want to say, 2 weeks and a half or so. Um, I didn't stick to it 100%, to be honest with you. I was eating like soft chicken and rice and a little bit of beans here and there, which maybe not the brightest idea, but it was soft foods, mashed potatoes. Um, so I chewed a lot. So I mean, I'm still living, but it might have affected the way I recovered from the surgery. That's what the surgeon told me when I went to see him recently. I went to see him a month ago. So I did have weight loss because I was in a liquid diet. So that's something that you might not even think about when you're having this surgery, but it happened to me. So I lost appetite. I wasn't hungry for the first like month and a half. I wasn't getting hungry, but that's it. You know, I would drink Ensure shakes and blenderized things, smoothies and stuff, and it was okay. But think about it: a whole 2, 3 weeks with just liquid, you're gonna lose weight. Um, and on top of that, after my liquid diet, when I went to solids or soft foods, I still wasn't getting hungry. So that's something that you should have in the back of your mind and just realize that it might happen to you. Um, it doesn't happen to everybody, obviously. Everyone's different. I saw some testimonial videos of people just being like, oh, I'm hungry, and just eating, and they're fine. So, everyone's different. Um, let's see, what else should we address? I have a few things that I feel like you should, or anybody who's dealing with acid reflux, it's bad, and it's getting in the way of their quality of life, it's affecting their quality of life. Um, you're obviously considering your options, right? Surgery, methods, medicine. Surgeries are going to be the ones that are going to be the most, um, uh, um, the ones that they do the most change in you, and the ones that will affect you as well. Because no surgery will come with no consequence. That's what I've learned. Um, but there is a few things that you can do. And I know this sounds kind of like a doctor thing to say, but your diet should be a change, your lifestyle rather, a lifestyle change of avoiding things that cause acid or bloating. Because trust me, with this surgery, especially a full wrap Nissen fundoplication surgery, you will be bloated, and you will be bloated for the first 3 months. I'm still experiencing bloating. It will get better, and it is getting better, and I hope it still gets better, because it could be pretty scary, to be honest. It could be pretty, depressing in a way, because I would get bloated with just drinking water, and it would be difficult to drink water with the first few weeks. Um, so that's my experience um, with the bloatingness. That's one of the biggest issues. And I read it before going with the surgery. I read it and I saw the side effects. Um, and I knew I was gonna get bloated, and I was like, okay, well, bloated, I'll deal with it. Better than the acid reflux, because everybody dealing with acid reflux knows you could be pretty miserable. But the bloating part is also pretty intense. It's um, it's debilitating. It affects what you do. Working. Um, Sometimes I couldn't even be standing up of how much how much air I had in my back and in my stomach area. Like I said, it's been better. It's improved, especially because I've been eating things. I've been on a low FODMAP diet, which is a low calorie diet, and avoiding things that will cause to be bloated. First of all, soda water, beer, so any kind of soda or carbonated drinks. I avoid them. I can drink them, but I'd rather not risk it, And I've had them, and I burp just a little bit, and it, 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 I'm able to do it. I'm able to swallow it and everything, but it makes it worse on your bloating symptoms. That's one thing. Certain things that cause gas, like vegetables and some beans and some vegetables do that to you. And there's a lot of things you can research and to see what kind of foods causes gas or bloating. Um, Another thing is that the gas pills that the doctor would prescribe you, in that case, that you tell them, oh, I'm feeling bloated from the surgery, and they'll be like, oh, take anti-gas medicine. For me, it did not work. Period. It just didn't work. I kept taking them. I haven't taken them recently because I've been monitoring it dealing with it with my eating habits. So that's the biggest change, the eating habits on the bloating side effects. It might be a thing that might work for me as of right now, because it's definitely improved. Um, and but I haven't tried them. I've just dealt with it with my eating habits. And so that's another thing, bloating. I have before you consider having surgery, like I said, think about changing your habits, eating habits, and anything that would give you acid reflux at the point of you not having the surgery yet. Um, let's see. There's a few options that you can do to deal with the acid reflux without doing surgery. Um, there's some therapy that I've read about on an article of a university, and I will put the description on the video so you can read about it. It's fairly new, but this therapy, um, to make it short, if you want more details, you can read the article. This therapy is with electroshocks. In some way, they put needles in your esophagus, and it's a therapy where they stimulate your muscle to grow sphincter in your esophagus, so you won't get acid reflux. Because we get acid reflux because at times we eat things that cause acid reflux, and also because um, your sphincter, it does not work properly. See, it stays open, or you don't have a good acid reflux. Um, I'm sorry, you don't have a good esophagus motility movement. So that could also be a thing. So that one works by doing that. You can read about it in the article and see if that's a thing that you might want to try. There's also the Lynx device. The Lynx device is a device, it's a magnetic rod bracelet with titanium that they put around your esophagus, clip it, tie it down, and then it expands as you swallow or and food goes through your esophagus, and it contracts when there's no food going through. And then that supposedly should prevent your acid reflux. I was originally considering that surgery. Now my surgeon, Dr. Michelati in University of Loma Linda, recommended me that um, the fundoplication surgery, Nissen, was the best option in his perspective, in his opinion, because he's done both, and he's had a few more situations with the Lynx device where he says it doesn't make sense to him that one size fits all, because that bracelet is one size, and they put it around your esophagus, and they don't tailor it to you. So at times you could have dysphagia problems where it's too tight or too loose. So, but the thing that convinced me to get the fundoplication Nissen surgery was because he said, obviously this doctor has a lot of experience. The surgeon is pretty good, and he said he tailors it to your needs, because there's people who are more husky, skinnier like me, and then it doesn't make sense that your esophagus is the same size for all. So one size fits all, he says, and that he's had a few more issues with the Lynx device. But that might work for you, so consider it. Talk to someone, talk to your surgeon, talk to your doctor, and ask him about that. My acid reflux, first of all, wasn't as bad as other people. I think I had like I don't know, like a 20 point something, where as to other people have like a 70, and that's really bad. But to me, it was bad because even water was causing acid reflux. Anything I ate was causing acid reflux. So that's how excruciating it was, and how bad it was to deal with it. And to the point where I considered surgery, and I had surgery for it. Um, Now, let's see. I don't know. I guess if you have any questions, I can try to answer them for you guys. If you comment on them. Um, it's been 3 months, 3 months and a few days since the surgery. I had the full wrap, so that's another thing. You could maybe consider having the partial wrap, where they don't tie your esophagus, your stomach completely to your esophagus. They do a partial, so it's like not all the way. There's another article that I will add in the description that talks about that option as well. Um, I would honestly just advise you to consider your options, because I didn't know that there was a partial wrap, and as of right now, I'm starting to not regret the full wrap. But there was a point in the past months that I regretted it, and I wanted it gone, and I just wanted to go back to the acid reflux. And this isn't no mean to scare you about it. You know, everything takes its course, and 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 you just have to kind of deal with it, you know. And so to some people, it might not be as bad as me. No, another thing that I should add is that I went to see my surgeon not too long ago because I was having issues and pain and bloating and all that stuff, and loss of weight and loss of appetite. Like I said, all those are better now. And you know, if you had the surgery or gonna do it, just think that it will get better. Maybe not 100%, but it will get better. So just try to be patient and be positive. Because the more positive I was, the better I felt. Believe it or not, it helps. The more you know, hopeful for the future I was by reading articles and being informed helped me to relax and to feel better in general. Now I went to see my surgeon, and my surgeon told me that he left enough space for me to vomit if I had to, and to burp. You know, that's something you have to do. You know, some people obviously have issues with burping after the surgery. Now, I've heard and I've read articles from experience that people start burping after like a year. So it can be kind of scary. But for me, I tend to for instance, if I take a sip of water, juice, or whatever, and I try to get most of the air out, see, I can burp. I can burp that much. So it definitely helps. But the thing is that if you don't, what I do that helps me is as soon as I take a drink of anything or eating, I make myself burp. Not obviously in public and, you know, as respectful as I can. If I'm at home, whatever. But it helps to not be as bloated. So if you can do that, and that's what the doctor and surgeon suggested as well, when you take something, try to burp it out as soon as possible, because when you have more bloating, more gas in there, and you want to burp it out after you're done eating, then it's going to be harder. There's more pressure, there's more bloating, and it's going to hurt. Now, another thing, let's see, I went to the surgeon and talked to him. Okay, so he said he left enough space in there. So I'm hopeful that, you know, within the future it will get better, and my body, my stomach's just gonna get used to the way it is. Because if you think about it, your stomach was sitting like this. My stomach was sitting like this. Now it's kind of like this, kind of straight. So it's different. The body feels it. So I'm getting better at that, and I'm feeling like things are working better. I do hear a lot of noises in my stomach, and it was concerning at first. But I talked to the surgeon. He said it's totally normal. And in fact, it's a good thing that you hear stuff moving in there, because it says it's trying to work as proper as it can. Um, yeah. So those are a few things that I've been experiencing. Um, I don't know. Tell me if you guys have any questions, or I think I'm gonna be uploading another video later on to talk about it within a few, maybe weeks or maybe a month after this, to see how I'm progressing. So I will be uploading another one, and I will try to organize my thoughts and questions. And sorry if I missed anything that you guys weren't concerned about or had a question of the guys who commented on the video. Um, so yeah. Yeah, so I pretty much covered what I think was the most essential things about it. I will put the link of the articles that I've read that gave me a lot of information on that. Um, and just if you already have the surgery, just try to deal with what you got the best way, and stay positive, because to be honest, I'm a really negative person. And it doesn't do you any better. You're already in the situation that you are, and you're just gonna have to make your body adjust to what you have. And at this point, sincerely, I would say I don't regret having the surgery. I don't. But there's days where it could get bad. But you're just gonna have to pull through, and hopefully, I'm hopeful that within the more time that passes, I will have less and less of those days where I get bloated and I have to just lay down. Um, and oh, I remember now. Another thing I wanted to address was dumping syndrome. My surgeon and doctors told me that is very. They almost made it seem like it's impossible for someone to get dumping syndrome after this type of surgery, after the Nissen fundoplication. Now, dumping syndrome, for those who don't know what that is when the food that you obviously eat or drinks go through your stomach, your esophagus, stomach, and get dumped into your lower intestine fast, like way too fast. So it doesn't. The body is kind of like unaware, kind of like a cold glass of water. It's like, whoa, what's going on? The body's unaware and unhappy that it's not a normal pass. It's a faster. So what that happens, what that causes is pain, cramping, bloating, and diarrhea. So that's the worst part. I've dealt with diarrhea since the surgery. That's another thing that's unfortunate. I never thought I was gonna deal with it. The doctors told me that it had nothing to do with it. That the reason why I have diarrhea is because I have IBS symptoms, and I do. But the tricky part is that I never had diarrhea this bad before the surgery, and I've dealt with IBS issues, yeah. But since the surgery been pretty obvious that I've dealt with it more. I've had diarrhea regularly when you eat something that doesn't sit you well and stuff, but this was like instantly after the surgery, diarrhea. Now I do take Imodium. Imodium has helped me a lot. The first times I took it, it didn't really make a difference, but I kept taking it, and it made a huge difference. I don't get as cramped. If you have IBS, it's a pretty good medicine. I don't get as many cramps. I don't get too bloated in a sense. It does help with bloating and diarrhea. That's the biggest thing that helps, the diarrhea. I take it every day. Um, it's a kind of okay pill. It's kind of a sweet taste. You can get it anywhere over the counter, Walmart or any pharmacy. Imodium. It has helped me if you're dealing with these issues of diarrhea. But yeah, like I said before this, just stay positive. What helped me also was that whenever I would get bloated, which for sure you're gonna get if you're doing the surgery, at least for the first few months, I would lay down. Laying down was a big help, and I would lay down on my side and move around, and then release the gas by farting it. Obviously, at this point, you're not gonna burp too much. That's just it. You're never gonna burp too much. So just forget about burping too much or releasing the gas in your stomach by burping all of it. No, you're gonna have to fart it out, and that's unfortunate, and it sucks, and it's embarrassing. But that's just one of the prices you're gonna have to do with the surgery. Now, I do have IBS, and IBS does cause gas, so you might not fart as much. For sure, the first few days you're gonna fart, and the first few weeks you're gonna fart a lot, and it's gonna be unfortunate. It sucks because of all the air in your body's getting used to it. Now, I've heard of people that stop farting as much, and then the body just it doesn't produce as much gas. In some way, it just gets better. Now, for me, it has gotten a lot better for sure. I don't fart as much as before, but I do. That is my main way of releasing bloating and gas and discomfort, by farting. And by all means, I'm gonna fart. I'm sorry, and I'm gonna be by myself, in a room, and try to make it as discreet as possible. But trust me, when you're in this much pain of bloating, you don't care. You just want to let it go. So laying down helped me. with the bloating. There's days where I would come from work and I only work 4 hours a shift at a restaurant, at sometimes a day, sometimes like 6 or 8. So I would come home and I would just lay down on the ground and stay there for a few minutes, maybe sometimes even an hour, and then it would definitely help. It would definitely feel a lot better. So I suggest you deal with the air with the first few months like that and farting them out. Like I said, we're all different. This might not help you, and I wanted to make it as short as possible, but there's a lot of things to talk about, so I'm going to try to make another video um, with the progress that I'm making, and if you guys have any questions, let me know as well. Um, yeah, so thank you for watching, and I really, really hope this helps, because it helped me to watch some testimonial videos as well. Stay positive.